1. What is the most appropriate first step when a dementia patient becomes agitated? A. Leave the patient alone. B. Restrain the patient. C. Identify and remove the trigger. D. Ignore the behavior. 2. Which communication strategy is most effective for interacting with someone with Alzheimer's disease? A. Using medical jargon. B. Giving multiple instructions at once. C. Speaking slowly and using simple words. D. Correcting their memory mistakes. 3. What type of environment best supports individuals with dementia? A. Noisy and stimulating. B. Bright lights and complex layout. C. Calm, consistent, and familiar. D. Isolated and silent. 4. Which of the following is a common early sign of dementia? A. Sudden high fever. B. Persistent fatigue. C. Memory loss that disrupts daily life. D. Visual hallucinations. 5. What is the primary goal of person-centered dementia care? A. Encourage independence at all costs. B. Follow a strict routine. C. Focus on the person's needs, preferences, and history. D. Administer medications as scheduled. 6. A patient with dementia begins to wander. What is the most appropriate CNA response? A. Lock the room. B. Redirect the patient to a safe activity. C. Scold the patient. D. Ignore the behavior. 7. When assisting with ADLs, what should a CNA keep in mind for a dementia patient? A. Complete tasks quickly. B. Maintain the patient's dignity and independence. C. Perform all tasks for them. D. Avoid involving the patient in the process. 8. Which activity is most beneficial for cognitive stimulation in dementia care? A. Watching television passively. B. Repetitive tasks without variation. C. Reminiscence therapy using old photos. D. Giving long lectures. 9. Which of the following is a safety risk specific to memory care units? A. Falls only. B. Wandering and elopement. C. Noise levels. D. Low lighting. 10. When a resident is experiencing sundowning, what does this mean? A. Their mood improves at night. B. They become more alert. C. They become more confused and agitated in the evening. D. They fall asleep immediately after dinner. 11. What is validation therapy? A. Correcting false beliefs in dementia patients. B. Ignoring irrational behavior. C. Accepting and respecting the person's reality. D. Forcing the patient to accept the truth. 12. A resident with dementia accuses staff of stealing. What is the best CNA response? A. Argue and defend yourself. B. Tell the resident they're wrong. C. Acknowledge their feelings and redirect. D. Ignore the accusation completely. 13. In memory care, which is the best way to help orient a resident? A. Tell them they are wrong if they are confused. B. Use clocks, calendars, and familiar items. C. Move them between units. D. Give them multiple tasks at once. 14. How should a CNA respond to repetitive questioning by a resident? A. Get frustrated. B. Tell them to stop asking. C. Answer calmly and redirect. D. Ignore the resident. 15. Which stage of dementia includes difficulty with basic ADLs? A. Mild cognitive impairment. B. Early stage. C. Moderate to severe stage. D. Pre-dementia. 16. What is a typical behavior in late-stage dementia? A. Mild forgetfulness. B. Ability to manage finances. C. Loss of motor skills and verbal communication. D. Independent dressing and bathing. 17. Why is a consistent daily routine important for dementia patients? A. It decreases physical fatigue. B. It increases confusion. C. It promotes independence and reduces anxiety. D. It helps them remember everything. 18. What role does nonverbal communication play in dementia care? A. It confuses residents. B. It is unnecessary. C. It supports understanding when words fail. D. It should be avoided. 19. A resident becomes combative during a bath. What is the best CNA action? A. Forcefully complete the bath. B. Call for immediate sedation. C. Pause, assess triggers, and try again later. D. Yell to gain control. 20. Which of the following is a key aspect of trauma-informed dementia care? A. Prioritizing efficiency. B. Avoiding eye contact. C. Recognizing past experiences and ensuring emotional safety. D. Keeping patients isolated. 21. How can a CNA promote nutrition in dementia care? A. Serve large, complex meals. B. Minimize meal times. C. Offer finger foods and familiar items. D. Restrict snacks. 22. What is a sign that a dementia patient may be in pain but unable to express it? A. Verbal complaints. B. Sleeping soundly. C. Grimacing and restlessness. D. Asking for pain medication. 23. What is elopement in memory care? A. Getting married secretly. B. Leaving the facility unsupervised. C. Choosing to relocate. D. Voluntarily isolating. 24. How should a CNA handle hallucinations in a dementia patient? A. Confront and correct them. B. Validate their feelings and ensure safety. C. Ignore it. D. Punish the patient. 25. A dementia resident refuses to eat. What should the CNA do first? A. Document refusal and move on. B. Call 911. C. Explore causes and offer alternatives. D. Scold the resident. 26. Which is a benefit of music therapy for dementia patients? A. Decreases appetite. B. Increases confusion. C. Enhances mood and memory. D. Has no benefit. 27. Which is most effective for reducing nighttime confusion? A. Bright lights all night. B. Quiet, calm evening routines. C. More daytime naps. D. Changing rooms at night. 28. Which type of reminiscence therapy tool is most effective? A. Math textbooks. B. Medical charts. C. Personal photo albums. D. Technical manuals. 29. When should a CNA report changes in a dementia resident's behavior? A. After 1 week. B. Only if asked. C. Immediately. D. Never, unless it's severe. 30. A resident begins pacing constantly. What is a likely cause? A. Happiness. B. Sleepiness. C. Anxiety or unmet needs. D. Obedience. 31. What does the term cognitive decline refer to? A. Emotional instability. B. Physical disability. C. Gradual loss of thinking and memory skills. D. Improved brain function. 32. What is the best way to reduce fall risk in memory care units? A. Keep residents in bed all day. B. Use restraints. C. Maintain clear walkways and good lighting. D. Lock all doors. 33. A CNA notices bruising on a dementia resident. What should they do? A. Ignore it. B. Wait for a nurse. C. Report and document immediately. D. Ask the resident for an explanation. 34. What is the 5 Rps approach in dementia care? A. Reassure, reorient, respond, record, remove. B. React, remove, reassure, run, remind. C. Reassure, redirect, respond, reassess, review. D. Resist, refuse, react, reassure, reorient. 35. What is an appropriate distraction technique during aggressive behavior? A. Loud commands. B. Offer a snack or activity. C. Physical restraint. D. Accusation. 36. How can a CNA support family members of dementia patients? A. Avoid contact. B. Provide accurate updates and emotional support. C. Give medical advice. D. Refer them only to doctors. 37. When should redirection be used? A. When a resident is calm. B. When a resident is lost in thought. C. When behavior is escalating. D. When staff are unavailable. D. Colored strobe light. 38. What is the best lighting for memory care? A. Flickering fluorescent lights. B. Dim, uneven lighting. C. Natural, consistent lighting. D. Colored strobe lights. 39. Which of the following may reduce agitation in a dementia resident? A. Frequent room changes. B. Yelling to gain attention. C. Familiar routines and calm environment. D. Overstimulation. 40. What is a life story used for in-memory care? A. Diagnosing diseases. B. Replacing medical records. C. Personalizing care based on a resident's history. D. Creating bedtime stories. 41. What's the first action if a resident with dementia becomes verbally abusive? A. Call security. B. Yell back. C. Stay calm and remove any triggers. D. Restrain them. 42. When transferring a dementia resident, a CNA should A. Skip explanation. B. Explain each step and maintain eye contact. C. Rush the process. D. Leave the resident alone. 43. What best describes a memory care unit? A. Hospital ward. B. Locked psychiatric facility. C. Secured environment designed for dementia care. D. Retirement lounge. 44. What should a CNA do when a resident forgets how to use a spoon? A. Mock them. B. Take over feeding. C. Demonstrate and gently assist. D. Ignore the issue. 45. A resident insists they need to go to work. What should the CNA do? A. Tell them they're confused. B. Redirect to a purposeful activity. C. Laugh and walk away. D. Lock their door. 46. Why is hydration important in dementia care? A. Prevents sleep. B. Reduces agitation and improves cognition. C. Causes incontinence. D. Induces sleepiness. 47. Which activity may reduce anxiety in dementia residents? A. Group debate. B. Timed math drills. C. Gentle exercise or walking. D. Loud music. 48. What is the purpose of a memory box? A. Decoration only. B. Sensory engagement and memory recall. C. Storage for laundry. D. Distraction during meals. 49. Which is the most respectful way to address a dementia resident? A. Hey you. B. Sweetie. C. By their preferred name. D. By their diagnosis. 50. How can a CNA help manage incontinence in dementia care? A. Limit fluids. B. Use shame tactics. C. Monitor toileting schedules and offer reminders. D. Ignore accidents. 51. What is the best approach when assisting a dementia resident with dressing? A. Choose clothes for them without input. B. Give one simple instruction at a time. C. Dress them without explaining. D. Let them wear anything regardless of safety. 52. A resident becomes paranoid and accuses others of stealing. What should the CNA do? A. Laugh at the accusation. B. Argue with the resident. C. Acknowledge their feelings and redirect. D. Blame another staff member. 53. What is an example of a positive distraction technique for dementia residents? A. Asking them tough questions. B. Offering an enjoyable sensory activity. C. Reading them news headlines. D. Ignoring them. 54. Which of the following best supports dignity in dementia care? A. Talking over the resident. B. Including them in personal care decisions. C. Ignoring their preferences. D. Rushing through tasks. 55. A CNA observes a dementia resident hoarding food. What is the best response? A. Scold the resident. B. Remove everything at once. C. Monitor behavior and offer reassurance. D. Ignore it. 56. What should a CNA do if a resident with dementia forgets their room? A. Yell at them. B. Lead them gently and use visual cues. C. Lock them in the hallway. D. Tell them to figure it out. 57. When providing oral care to a dementia resident who resists, what is appropriate? A. Skip it completely. B. Use force. C. Try again later with calm reassurance. D. Call security. 58. How can the CNA reduce overstimulation during meals? A. Keep the TV on. B. Seat residents in a loud group. C. Create a quiet, calm setting. D. Offer complex food options. 59. A memory care resident suddenly becomes more confused than usual. What is the CNA's first step? A. Ignore it. B. Document only. C. Report to the nurse immediately. D. Restrain the resident. 60. Why are memory boards used in dementia care? A. Entertainment. B. Punishment. C. Provide visual cues and reminders. D. Decoration. 61. When communicating with a nonverbal dementia resident, a CNA should A. Stop all attempts. B. Focus only on verbal language. C. Use touch, gestures, and facial expressions. D. Talk to other staff instead. 62. A resident keeps walking into other rooms. What's the best approach? A. Yell at the resident. B. Redirect to a purposeful activity. C. Confine them. D. Accuse them of theft. 63. Which behavior is common during middle-stage dementia? A. Independent self-care. B. Financial planning. C. Repetitive speech or questions. D. No signs of memory loss. 64. What is the first priority when responding to aggressive behavior? A. Use physical restraint. B. Ensure the safety of everyone. C. Call the family. D. Argue back. 65. Which of the following is an unmet need that might cause agitation? A. Hunger or thirst. B. Contentment. C. Proper medication. D. Social interaction. 66. A CNA hears a resident crying softly. What should they do? A. Ignore it. B. Reassure and ask gently about their feelings. C. Tell them to stop. D. Call the doctor immediately. 67. What's the role of consistency in dementia care? A. It causes confusion. B. It decreases stress and improves behavior. C. It's irrelevant. D. It limits resident choice. 68. Which sense is often used in sensory stimulation for dementia residents? A. Only vision. B. Only hearing. C. All 5 senses. D. Only smell. 69. Which of the following is a common cause of sleep disturbance in dementia? A. Clear routines. B. Comfortable environment. C. Sundowning and disorientation. D. Proper sleep hygiene. 70. A CNA notices a dementia resident repeatedly folding napkins. What is this behavior? A. Agitation. B. Wandering. C. Repetitive self-soothing activity. D. Sign of delirium. 71. A dementia resident becomes angry when asked to bathe. What should the CNA do? A. Force the bath. B. Delay the bath and try later using calm tone. C. Yell for help. D. Ignore the behavior. 72. How can familiar music help a dementia resident? A. Trigger aggression. B. Encourage withdrawal. C. Evoke memories and soothe emotions. D. Overstimulate them. 73. A CNA should help dementia residents maintain independence by A. Doing all tasks for them. B. Ignoring their efforts. C. Assisting only when needed and encouraging participation. D. Rushing through care. 74. If a dementia resident cannot recognize family members, the CNA should A. Force recognition. B. Remind them constantly. C. Be supportive and avoid correcting. D. Avoid all family visits. 75. What is the term for falsely believing something not based on reality? A. Depression. B. Delusion. C. Hallucination. D. Anxiety. 76. What is a common cause of aggression in dementia? A. Too much sleep. B. Hunger, pain, or frustration. C. Success at tasks. D. Quiet environment. 77. Which of the following is the best visual cue in a memory care unit? A. Mirrors in rooms. B. Identical doorways. C. Name signs and personal photos on doors. D. Blank white walls. 78. Why is personalized care important in dementia? A. It saves time. B. Residents are all the same. C. Enhances comfort and reduces confusion. D. Makes documentation easier. 79. What is one key reason dementia residents may become socially withdrawn? A. Desire to be alone. B. Lack of interest in activities. C. Fear of failure or embarrassment. D. Strong physical health. 80. A CNA should use touch cautiously because A. It always calms residents. B. It may trigger trauma or discomfort. C. It replaces speech. D. It has no effect. 81. When assisting with toileting, what is helpful for a dementia resident? A. Waiting for accidents. B. Complex instructions. C. Scheduled prompts and visual signs. D. Ignoring cues. 82. What is shadowing in dementia? A. Wandering away. B. Following staff or others closely. C. Sleeping often. D. Forgetting tasks. 83. What type of clothing is best for dementia residents? A. Complicated outfits. B. Tight buttons and laces. C. Simple, easy-to-use garments. D. Formal wear. 84. What should a CNA do if a resident becomes frightened during care? A. Force completion. B. Use a calm voice and explain slowly. C. Ignore the fear. D. Restrain them. 85. Why is life history important in care planning? A. For billing purposes. B. Helps personalize care and build rapport. C. To compare with others. D. It's not important. 86. Which activity can encourage mobility in dementia care? A. Watching TV. B. Gentle exercises or walking. C. Long naps. D. Reading quietly. 87. How should a CNA react when a resident insists on going home? A. Say you live here now. B. Lock the doors. C. Acknowledge the feeling and redirect. D. Call the doctor. 88. Which is an example of promoting autonomy in dementia residents? A. Letting them decide between two outfits. B. Dressing them completely. C. Ignoring their preferences. D. Choosing food for them. 89. Which is a non-pharmacological approach to managing agitation? A. Antipsychotics. B. Restraints. C. Aromatherapy or pet therapy. D. Isolation. 90. What is the purpose of name tags for dementia residents? A. For staff convenience only. B. Help with recognition and orientation. C. Decoration. D. Privacy invasion. 91. How should a CNA respond if a dementia resident uses profanity? A. Scold them. B. Use profanity back. C. Stay calm and redirect. D. File a complaint. 92. What does preserved procedural memory mean? A. Forgetting all skills. B. Retaining muscle memory like brushing teeth. C. Hallucinations. D. Recognizing faces. 93. Which is a respectful way to assist a resident with memory loss? A. Say you don't remember anything. B. Provide gentle prompts. C. Give pop quizzes. D. Force memory recall. 94. What's a key safety measure in memory care dining? A. Offer hard candy. B. Monitor for choking risks. C. Rush meals. D. Leave residents unsupervised. 95. What should a CNA do if a resident eats non-food items? A. Encourage it. B. Punish them. C. Prevent access and report immediately. D. Take pictures. 96. What is a common emotion for family members of dementia patients? A. Joy. B. Confidence. C. Guilt or sadness. D. Relief. 97. How can CNA reduce noise agitation triggers? A. Increase music volume. B. Play random sounds. C. Minimize background noise. D. Add loud alarms. 98. Which document helps track behavior patterns? A. Nursing license. B. MAR or medication admin record. C. Behavior log chart. D. Caregiver ID. 99. How can caregivers reduce boredom for dementia residents? A. Provide meaningful and familiar activities. B. Let them sleep all day. C. Ignore requests. D. Give long lectures. 100. Which of the following best defines dementia? A. Temporary forgetfulness. B. Acute mental illness. C. Progressive decline in memory and thinking. D. Sleep disorder. 101. What is the most effective way to gain the attention of a dementia resident before speaking? A. Call their name loudly. B. Approach from behind. C. Approach from the front and make eye contact. D. Wave hands rapidly. 102. A resident with dementia becomes fixated on going to work. What should the CNA do? A. Remind them they are retired. B. Argue with them. C. Validate the feeling and redirect to a task. D. Tell them it's Sunday. 103. What should a CNA do if a resident is unable to complete a task? A. Finish it immediately. B. Let them struggle. C. Break it down into smaller steps. D. Take over completely every time. 104. Which is an appropriate way to support nutrition in residents with dementia? A. Remove meal options. B. Offer finger foods and adaptive utensils. C. Feed all residents regardless of need. D. Restrict meal time. 105. What behavior may indicate a urinary tract infection in a dementia resident? A. Calm demeanor. B. Decreased appetite only. C. Sudden confusion or agitation. D. Increased energy. 106. A CNA sees a resident pacing repeatedly. What is a proper response? A. Restrain the resident. B. Give them a sedative. C. Provide a safe walking space and observe. D. Confine them to their room. 107. What is the role of validation therapy in dementia care? A. Correct wrong statements. B. Ignore false beliefs. C. Respect emotions and redirect with empathy. D. Test memory. 108. When documenting care for dementia residents, the CNA should A. Be vague to save time. B. Record only incidents. C. Use objective, clear language. D. Add personal opinions. 109. A resident with dementia becomes disoriented in a new environment. What should the CNA do? A. Ignore the behavior. B. Minimize changes and use visual cues. C. Move their belongings. D. Introduce more people at once. 110. When a resident with dementia becomes tearful without reason, the CNA should A. Ignore them. B. Offer a comforting presence. C. Distract with a loud noise. D. Question their behavior. 111. Why is reminiscing beneficial in dementia care? A. Prevents all symptoms. B. Encourages arguments. C. Connects to long-term memory and boosts self-worth. D. Causes confusion. 112. What should a CNA do if a resident expresses fear of bathing? A. Say they have no choice. B. Skip the bath permanently. C. Try alternative methods and times with reassurance. D. Use cold water to reduce time. 113. How does routine benefit residents with dementia? A. Encourages dependency. B. Increases confusion. C. Provides structure and reduces anxiety. D. Limits activities. 114. What is the primary goal of memory care? A. Cure dementia. B. Maximize independence and quality of life. C. Remove all decisions. D. Avoid all change. 115. A dementia resident frequently misplaces items. What should the CNA do? A. Blame the resident. B. Reprimand them. C. Help look and offer reassurance. D. Ignore the concern. 116. What is a common characteristic of Alzheimer's disease? A. Sudden onset. B. Rapid recovery. C. Gradual memory loss. D. Delusions only. 117. What is the best way to cue a resident with dementia? A. Shout instructions. B. Use gestures and short phrases. C. Give complex directions. D. Hand them a manual. 118. Which technique helps prevent wandering? A. Keeping doors open. B. Increasing TV time. C. Scheduled walks and structured activities. D. Ignoring the behavior. 119. A resident frequently repeats the same question. How should the CNA respond? A. Ignore them. B. Respond patiently each time. C. Scold them. D. Leave the room. 120. Which of the following is a respectful communication strategy? A. Use baby talk. B. Speak rapidly. C. Use the resident's name and speak clearly. D. Avoid direct contact. 121. A CNA should report what change immediately in a dementia resident? A. Consistent behavior. B. Increased cooperation. C. Sudden withdrawal or agitation. D. Asking for help. 122. What activity is most beneficial for late-stage dementia residents? A. Problem-solving tasks. B. Puzzles. C. Gentle music or hand massage. D. TV shows with fast dialogue. 123. When a resident cannot verbalize pain, the CNA should watch for A. Laughter. B. Facial grimacing and restlessness. C. Constant sleep. D. Increased talking. 124. A dementia resident becomes suspicious of others. What should the CNA do? A. Argue to correct them. B. Validate emotions without reinforcing suspicion. C. Involve the police. D. Ignore them. 125. What is one way to reduce fall risk for dementia residents? A. Keep environment cluttered. B. Use rugs with curled edges. C. Provide good lighting and clear pathways. D. Let them walk unsupervised at night. 126. When a resident becomes frustrated during dressing, the CNA should A. Remove all clothing options. B. Offer encouragement and simplify choices. C. Force the process. D. Ignore them. 127. Which tool is most appropriate for assessing memory care needs? A. Blood pressure monitor. B. Dementia staging guide. C. Stethoscope. D. X-ray. 128. A resident calls out repeatedly during the night. What might be the cause? A. Contentment. B. Normal behavior. C. Discomfort, fear, or confusion. D. Desire to be disruptive. 129. What is a sundowning behavior? A. Improved clarity in the evening. B. Increased confusion and agitation at dusk. C. Sleeping deeply at night. D. Alertness after meals. 130. A dementia resident clutches a stuffed animal and becomes distressed if it's removed. What should the CNA do? A. Hide the item. B. Allow the resident to keep it for comfort. C. Replace it with a toy. D. Throw it away. 131. If a resident with dementia becomes combative, the CNA should first A. Try to restrain them. B. Leave the room and call security. C. Back away and ensure safety. D. Yell for help. 132. Which food choice is best for a resident with chewing difficulty and dementia? A. Steak. B. Hard crackers. C. Soft scrambled eggs. D. Dry toast. 133. Which environment best supports memory care? A. Loud and crowded. B. Bright with harsh lights. C. Familiar, quiet, and structured. D. Isolated and dark. 134. If a resident confuses the CNA with a family member, the best response is A. Correct them harshly. B. Go along gently if it brings comfort. C. Ignore them. D. Use the opportunity for reorientation. 135. Which is an example of purposeful activity in memory care? A. Sorting laundry. B. Standing still. C. Random pacing. D. Watching loud TV. 137. Which of the following is most calming for residents with dementia? A. Flashing lights. B. Conflicting background noises. C. Familiar soft music. D. Being left alone all day. 137. Which of the following is most calming for residents with dementia? A. Flashing lights. B. Conflicting background noises. C. Familiar soft music. D. Being left alone all day. 138. What is reminiscence therapy? A. Reviewing negative past events. B. Discussing current politics. C. Engaging in conversations or activities about past memories. D. Practicing math skills. 139. What is a common reaction of dementia residents to mirrors? A. Reassurance. B. Indifference. C. Confusion or fear. D. Confidence. 140. Why should CNAs avoid open-ended questions with dementia residents? A. They are impolite. B. They cause more confusion. C. They improve memory. D. They test logic skills. 141. What is a common cause of weight loss in dementia? A. Too much exercise. B. Loss of interest in food or forgetting how to eat. C. Metabolism. D. Excess snacking. 142. How can CNAs support bowel regularity in dementia care? A. Restrict fluids. B. Avoid fruits. C. Encourage hydration and fiber intake. D. Allow bed rest all day. 143. Which technique supports independence at mealtime? A. Offering complex meals. B. Removing utensils. C. Using hand-over-hand assistance as needed. D. Feeding every resident. 144. A resident often forgets to swallow. What is the CNA's concern? A. Overhydration. B. Choking risk. C. Sleep deprivation. D. Allergies. 145. When should CNAs communicate changes to care plans? A. At the end of the month. B. Once a year. C. Immediately to the nurse. D. After telling the resident. 146. Which statement is true about hallucinations in dementia? A. They're always dangerous. B. They never occur. C. They may seem real and require calm reassurance. D. They should be punished. 147. What is the term for not recognizing familiar people or places? A. Orientation. B. Agnosia. C. Confabulation. D. Dysphagia. 148. What is the CNA's role in dementia safety? A. Avoid involvement. B. Monitor, report hazards, and implement precautions. C. Wait for others. D. Stay in one area. 149. What is the benefit of labeling cabinets and drawers? A. Increases confusion. B. Adds clutter. C. Helps with orientation and independence. D. Reduces memory. 150. How can CNAs encourage fluid intake in dementia residents? A. Ignore refusals. B. Offer drinks only at meals. C. Provide fluids regularly in small amounts and favorite cups. D. Avoid reminding them. 151. What is one reason residents with dementia may resist care? A. They enjoy arguing. B. They feel rushed or confused. C. They want to be independent at all costs. D. They dislike the caregiver. 152. Why should CNAs limit background noise during care? A. It helps other staff concentrate. B. It reduces the chances of sundowning. C. It prevents overstimulation for the resident. D. It saves electricity. 153. Which of the following is a helpful way to support identity in dementia care? A. Refer to residents by their room number. B. Call them dear or honey. C. Use their preferred name and personal items. D. Avoid talking about their past. 154. What can help prevent confusion during transitions between activities? A. Skipping announcements. B. Giving clear cues and allowing extra time. C. Changing activities quickly. D. Avoiding routines. 155. Which sensory item might calm a resident during agitation? A. A scratchy blanket. B. A soft textured pillow or fidget item. C. Cold metal chair. D. Loudspeaker system. 156. What is the term for making up stories to fill memory gaps? A. Confabulation. B. Hallucination. C. Delusion. D. Perseveration. 157. Why are visual meal menus with photos helpful for residents with dementia? A. They improve the decor. B. They provide entertainment. C. They support decision-making and recognition. D. They reduce food costs. 158. What should a CNA do if a resident undresses in public due to confusion? A. Scold and embarrass them. B. Gently guide them to privacy and redress. C. Yell for help. D. Call their family immediately. 159. Why is reducing clutter important in dementia care environments? A. It makes the room look fancy. B. It helps prevent overstimulation and falls. C. It allows staff to clean faster. D. It entertains residents. 160. A dementia resident begins crying during grooming. What should the CNA do? A. Stop and ask what's wrong gently. B. Continue as usual. C. Complain to a coworker. D. Leave the resident alone. Memory Care CNA. The Memory Care or Dementia Care Certified Aid exam, often associated with standards from the American Caregiver Association or ACA or similar credentialing bodies, is designed to assess a caregiver's knowledge and competency in providing specialized care for individuals with Alzheimer's disease and other forms of dementia. This exam evaluates understanding of memory loss, communication techniques, safety, behavior management, and person-centered care strategies. It ensures that aides are trained to offer compassionate, respectful, and effective support while maintaining the dignity and independence of those with cognitive impairments. Earning this certification demonstrates a professional commitment to excellence in dementia care and enhances employment opportunities in memory care units, assisted living facilities, and home health settings. Here are the top 5 beneficial uses of memory care or dementia care certified aide exam. 1. Enhanced job qualification. Certification proves a caregiver's expertise in dementia care, making them more competitive in hiring processes within memory care facilities and home health agencies. 2. Improved patient outcomes. Certified aides are trained to manage challenging behaviors, ensure safety, and promote emotional well-being, leading to higher quality care for dementia patients. 3. Increased confidence and skill. The exam reinforces essential knowledge, giving caregivers confidence in handling complex dementia-related situations with compassion and professionalism. 4. Career advancement opportunities. Certification can lead to promotions, leadership roles, or specialization in dementia care settings. 5. Recognition and credibility. Being certified establishes the caregiver as a knowledgeable and dedicated professional, gaining trust from families, employers, and patients.